So I want to turn to one really important question, which is how can we protect ourselves from COVID-19? We all recognize across the country, provinces are opening up, going into different stages where people are able to go to businesses, to, like here in Alberta, movie theaters are going to be opening up soon. And the question is, as society opens up, what can we do to protect ourselves to minimize that risk that those cases that have been slowing down in so many parts of the country won't start to speed up in the other direction? Well, one of the key things are masks, and I just wanted to highlight, this is Joseph Windsor, Joey Windsor, and Stephanie Coward. Joey's a postdoc in my lab, and Stephanie did her PhD with me, and she's now my IBD unit's epidemiologist. They're donning on these very fancy Crohn's and colitis masks, and I want to particularly thank them because every week Stephanie crunches out numbers that I can present to you in these webinars, and at the same time, Joseph is the one making all of the fancy slides as well as splicing a lot of the videos. So why is wearing masks so important? Well, this is data coming from the Lancet. This is data that was published just in the past week. It's a systematic review, and so what the authors did in this study is they took all the studies that have been published looking at what protects against transmission, both in the last few months, studies being published last few months in relationship to COVID-19, but also looking at other similar viruses like SARS and MERS from previous outbreaks. And what they showed was that if you wore a protective mask, your risk of acquiring COVID or being transmitted the virus was much lower than if you didn't wear a mask. So again, very important to wear a mask. And again, I would encourage you to get the very cosmetically appealing Crohn's and Colitis Canada masks. And of course, physical distancing is really important. When they looked at this systematic review and their meta-analysis, they showed that if you can keep yourself away from individuals, you can reduce your risk dramatically. If you were within a meter of somebody, at risk of being transmitted is roughly 13% versus a 2.6 risk if you can be between 1 to 2 meters. And very importantly, as you stretched out that distance from 1 to 2 meters to 2 to 3 meters, and then 3 to 4 meters, you start to reduce that risk even further by 50% with each meter that you're far away. So, I mean, this is not something new. We've been telling you this over the past few months. It's just very good data to support messaging that we've had, and we hope that that you continue to do these two key things as you start to experience more of the country outside of your home.
So let me do this right now. Let me put on the mask. I see so many people wearing a mask, you know, at grocery stores and Costco and other places. I wanted to make sure people understood that this is the way you should be wearing your mask, right? So it should fit around your nose all the way down to your chin. This is not an effective way of wearing a mask. And this, as we see on the news every night, is definitely not an effective way of wearing a mask, despite what the politicians will have you believe. So please, please, if you're going to go out and you're going to protect yourself and other people, wear the mask like that. Try to pinch it up over your nose and allow it to go under your chin there, okay? Thank you.